or 40. Right? So then position number 2, and we're gonna go to the same, we'll do all 3 on the one side, and then we'll move and do all 3 on the other side, okay? So that one was down and up. So the next one is sitting up nice and tall. You're going to go to ear to the shoulder, and you're gonna take the same hand and put it on top and just kind of, yep, and you should feel it directly under that other side, under that ear. Again, hold for 30 to 40 seconds. Okay, if you're ready. Third position is, again, sitting up nice and tall, looking up as far as we can, and then turning the back of the head so that we're stretching that front part of the neck. So, yep, like that. There you go. See if I can see others doing it. Yep. And that one you can't really apply more pressure to. That one's harder to, you know, make it more, but looking up and holding, and you can see mine is nice and tight right there and it's stretching good. And when you're ready for the next side, we're going to do the opposite. So whatever knee that you pointed at first, go to the other one. So you're going to look down and then point your head over at the other knee. You should feel it directly on the other side. And again, if you need to add a little pressure, you can hold towards the back of your head and kind of come down. Okay. And again, hold for 30 to 40 seconds. So if we're ready, we can do that next position. And again, it's sitting up nice and tall, and it's ear to the other side. Whatever one you stretched on before, do the other one. And again, you can add a little pressure by holding the top of your head. Whew, I can feel that one. You can feel that one too, Diane? Oh, yeah. Yep, some parts are tighter than the others, and you may feel certain ones more one day than the next day. So when you're ready, let's do that last one. Remember, it's the one where you're looking up as far as you can, and then slightly turning your head and stretching the front of that other side. And 30 to 40 seconds. Did that feel good? Hope that felt good for everybody. Good. And that's something that you can do while you're watching TV, or you're just sitting at a red light, or or you're just in the classroom by yourself, or wherever. All right, I'm asking her a question about how long the session was supposed to be, because I was told 15 minutes, but she said 55. So I can move on to the arms and the hands in just a minute. I'm just confirming with her. All right, let's see. So we have 20. Yep, that's what I'm reading too. I have 2. All right, so let's see. We've got the shoulder shrug done. We did the 2 trigger points. I did the 6-way stretch. And let's add, trying to figure out a few more that I can do and show you how to do some. We can, let's see, I don't know if I can do that. This is me brainstorming. Ooh, any leg stretches to share? Absolutely, we can share some leg stretches. I like getting my questions. Absolutely, chat me some questions. Leg stretches, like as in hamstrings. That one's going to be a little harder for me to demonstrate. Let's see if I can stand up. So, using a chair, I'm going to kind of make it so you can see my waist. Okay. So, using a chair, you can bring your leg up and you can reach for your feet. Yeah, even if you're sitting down, you can put your foot up just a little higher and reach for your, if you can grab your ankle or if you can grab your foot, and you'll feel the stretch all the way up to the top of the hamstrings at the base of your thighs. And you can do that. You can do this stretch when you get out of the car. You can put it just in the car and you can lean down and stretch, and then you can always switch the other leg and do the same stretch. There are other stretches for a lot. Also, I need to stretch. Oh yeah, you can definitely feel that hamstring stretch when you do that one, especially if we sit a lot. Now another one, because we sit a lot, and I'm going to stand up and show my waist, is right here in our front hip flexors on our hip, the front parts of our hips. And one for that is actually a yoga pose called the warrior pose. And that one I can show you from the waist down. It's like a lunge, but what it does is having this leg straight back in the lunge position stretches this front part of the hip out. So a nice lunge, and you can do the hand movements with it, and that'll help stretch the shoulders. So that is, let me see if I can get a full picture, sorry. Didn't know how much room I was going to need. So, this is a warrior pose. Braden, can you make it so it looks at my, yeah, you're seeing the dust. So it's like a deep lunge, and that'll stretch that front hip flexor right there. Thank you, Braden. My technical assistant trying to help me. Let's see what else. Now you can always do stuff on the floor while you're watching TV. You can do, I do a lot of stuff while I'm watching TV because I know that I don't like to exercise out there. So I want to do stuff that I can do and work out on my own time. So I try to think of things that I can do, you know, where I'm most at. And those stretches, the hamstring stretch, the 6-way stretch, those can all be done wherever. Let's see. There's also the one where you lay on your back and you can raise your leg to stretch your hamstrings that way. Or you can sit and do the, you know, sit and like almost not in the splits, but you know, with our legs wide, and we can reach to our toes to stretch out the inside of our legs, you know, trying to get all parts of the legs stretched out. We can do a couple stretches for our shoulders that are actually good stretches to do for the upper back as well. I'll show you this one. So it's bringing our hand back so that we touch the back of our shoulder. And then you can hold the other elbow with our other hand and kind of pull it across, and that'll stretch this inside part of our shoulder. So this is just one more, yep. So put it behind your head, and then with our other arm, just kind of pull on it, and you'll feel that stretch go down. And you can hold again for your 30 seconds. Looking good there. Everybody's looking good. And then remember, as always, stretch that other side to even it out. And wiggle it out and let it relax after that. That feel okay? Good. Wish I could T-roll. I want to show you how to T-roll, which is a foam roller, but I don't have a foam roller to show you. Foam roller to T-roll, it would be to do a roll leaning backwards on it, which helps your spine move better together. I did not prepare for that move. Sit up and not doing. Yeah. So to stretch out that upper back, leaning back over something helps stretch out this as well and helps us from having that forward neck position. So let me see if I can. Yep. So what you would do is you would lay on the floor or the bed, and you would take a rolled up towel and you would put it across your shoulders this way, and you would lean back on it like that and holding that for 2 minutes that way. And what that does is it helps the way that our spine is, and it helps the joints move together by bending it back the other way, by stretching it out. And so you would do a spot here where you would lean back, and you would do a spot just below where you would lean back on that roll to stretch it out over that towel, that rolled up towel. So that's another move that you can do to help get some of that upper pressure and getting that teacher's hump that we all know that we get from looking down at kids' desks for years of great service. Any other questions or stretches or an area that you might want me to, because I am going to do hands and arms and stuff for the next session. So is there any other?
Rosalind, this is Angela.
Yes, hello.
Hi, I'm sorry there was confusion because are you doing different things in the second session, it sounds like?
Well, I was gonna do, I can do the hands and arms now too, and then do the same thing again for the second one, because I was just gonna do two separate ones, because I thought it was two 15-minute sessions. I didn't know it was 55.
No worries. It was 8 o'clock and 9 o'clock, but it's okay.
I knew that. I just didn't know it was almost that time. That amount of time, I should say.
It's okay. If you're able to do that, I think that would be great. That way they can have the full experience of what you have to share.
Absolutely.
And then hop on to one of the paintings or the yoga, if that's okay.
Okay. Yeah, absolutely. So let me go on with the forearms and the wrists and the hands and stuff then. So with using our computers a lot now, we are finding we are mousing a lot, and we might start to get tight hands and arms, which can be this whole area in here. So first I'm going to show you how to, it's called stripping the forearm, and all it is, make sure I can see. So it is taking your thumb and starting at the wrist right here where the two little bones are. So between your ulna and your radius, just start right here. And you're gonna glide all the way up with a little bit of pressure to the elbow. Okay, you do that. Do that about 3 to 5 times, and you can feel it in there. It's tight, it can be a little lumpy in spots. It might be tender when you get up to the elbow. Are you guys feeling that? So just a light pressure, and you just glide up through those 2 bones in your arm. So then, as you could feel, maybe right up here, there might have been like a little hard thing, or it felt like a little bit of like a knot is what we would call that. And just little circles, and you can rub out that knot. It might hurt, it might send some little twinges into your elbow or even down into your wrist, just depending on how tight it is. So you can just work that and just do little circles. You can also flip it over, and you can, this one's a little bit harder. You tend to start at the elbow and go towards the wrist. And that is stripping that part of the forearm. That's if that part hurts. And you can also rub right here at the elbow joint and right up. And that might feel a little weird, like you hit your funny bone, because that is where the nerve of your humerus, that comes through the humerus right here. So you can rub that. So this is where a lot of people get tennis elbow, and that's why we like to keep that loose, and golfer's elbow on the inside. So keeping that loose is important, because those are the muscles in here contribute. When these get tight, it can contribute to the carpal tunnel syndrome in our wrists, because if these are tight, they're pulling on the attachment points up here in the wrist. Now you can also, with kind of like a C shape, you can kind of pinch, and yep, you can move it, and you can feel, kind of loosen your wrist up by, you know, and you can kind of rub in there a little bit. You can feel all the little bones in the wrist joint. And then that same stripping motion, you can come down hand and go between each, so between the fingers, and you can rub down through the fingers. So once you get the hand, the wrist loosened up, then you start at the wrist and you do that same kind of stripping motion where you go down to through the fingers, and you can strip the hand like that. So now I'm just kind of doing that. I'm doing that one motion that I did to my forearm, but I'm doing that right to the palm of my hand. Kind of working out any tension in the palm. Also, a trigger point in the hand is right here in the thumb area. Our thumbs get lots of action on the mouse and moving it around, so we want to make sure that this stays loose as well, so we can pinch and hold in the center of the thumb, and that'll help relax that thumb muscle. But you can also do that same thing that we were doing to the wrist, but do that to the thumb and kind of work the thumb and that in a kind of massage the thumb out. So once we get the hand all loose, and like I always say, you do the other side to keep even. So I always start back with my stripping of my forearm. So go up that other side. And then once you find some of those little knots or tender parts, you can go back and do the circular motion with a little bit of pressure and kind of rub around between the ulna and the radius in your forearm. Got one right there. I'm going to work on that a little, get a little. And you can always, like we did the trigger points here in our neck, if you have a spot on your arm where you felt a little knot in a tight spot, you can do that same thing where you kind of press and hold the knot. What you're waiting for is for it to feel softer underneath your finger. So I'm just holding, I had a knot right there. So then once you get that forearm other one loosened up, you're going to do the wrist as well and the hand, sliding through that other hand. Yeah, so you slide up through the palm and you kind of strip between each finger. Again, work on that thumb. And then we're going to do 2 stretches. So we're going to interlock our fingers. The first stretch we're going to do is we're going to flip our hands over like that. And then you're going to push out so your arms are straight. And I know you can feel that stretch in the fingers and up the forearms. You can hold for 30 and just kind of let it stretch. Yep, all the way up to the arms. Okay, then another one that we're going to do, I'm going to stand up. So this one is going to stretch the forearms, and you can do this on any table. So what you're going to do is you're going to turn your hands like facing palm down, but facing you, and you're going to put them flat onto the table, and you're going to press the palms down on the table. What that does is that stretches the whole inside forearm, and it does stretch the back. So this is a stretch that we do in massage therapy for releasing the forearms after working on people all day. So it just is turning your palms down, turning them back, and stretching by placing force down on the palms. And again, you can hold for 30 seconds, or you can do it a couple times in a row to achieve the stretch up in your forearm. All right, let's see. And then you can always do the crossbody one just to add one more stretch for the shoulders and the upper part of the arm, which is the crossbody. And again, you put pressure on that elbow, and you should feel it slightly here and more back here. It shortens the muscles here, so you feel it kind of, then you feel it stretch back here. So yep, across the body and hold, and across the body and hold. Now for some that can do it, there's one more where you put your hands behind you and lock the fingers together. This one's a little bit harder. So what it is what it's gonna do is it's gonna stretch the upper part. And so you're gonna lean forward and you're gonna bring your shoulders up. And you just hold for a little bit. And that you will feel in this whole part up here in the front part of your chest, and you'll feel it down into the arms when they're back. Yep, just like that. That one's a little bit harder because not everybody can get their hands together behind their back, but it's an important one, and we should all be able to touch our backs and put our hands back there, and this should be loose enough to do that. And that, if we keep practicing that, that'll help loosen up this front part and up into the neck. Oh, I had somebody ask me for some shoulder exercises just now that we just went over with. I'll go over those last three that we did. The one like this, the one across, and then that other one. So the first one that I showed for the shoulders was bringing it up and over and applying pressure to that. Yep, and holding, and always do the other side. Yep. And then the second one was bringing the arm across and over and applying pressure to that elbow, and that should stretch it back here. And yes, always the other side. As well as that one that I just got done demonstrating, where you clasp your hands behind you and bring them up and over. And that'll stretch out the front and down the arms as well. And then what was the other one? This one gets more of your hands and your forearms, not too much into your shoulders, but it does stretch from all the way down. You know, when you think of the path of the muscles and everything's connected, so it does still stretch from way up. Oh yeah. Good. See everybody practicing and doing it. Looking good. Looking good. All right. Oh, nice 6-way stretch there, Lindsay. That was a good going back. Yep, your goal for that one is eventually you want to be able to have your face, you know, flat with the ceiling so that you're looking as far up as you can, because our necks should be able to look all the way up. Yeah, and that's such a great one for our necks. It really does help elongate and stretch and strengthen the necks out. You can always practice that shoulder shrug too. Remember the one where you go up with your shoulders, tuck your chin and kind of scrunch it together and then let it down and relax it. And that'll help that too. Good. Good. I like seeing everybody practice. Good job. For pain just below the bra line across my back. Yes. So that rolled up towel that I was talking about earlier, that is definitely something that can help with the pain across the mid back. Let me see if I can demonstrate that. I'm at work, so I've got to find something I can use. Okay, I'm just going to go on the floor in my break room. I'm gonna get a towel. Okay, so obviously you would want a towel much bigger than this, but this is all I have. So you would want to maybe like your bath towel. You want something about that big, okay? So what you're going to do is you're going to place it there. You can do this on the floor and the bed's going to be a little bit softer. You may not feel it as much if you do it on the bed. So you will line that towel up right with the bra line, and then you're going to lean over it and lay down, and you're going to hold that spot for 2 minutes in that area. So then once you're done with that 2 minutes, you're going to move the towel up maybe an inch up, and then you'll lay back down on it, and you put your arms up kind of in a hold them, stick them up position. See if I can show my hands. So kind of like this. And you're going to work up to 2 minutes in those spots, and you just keep moving that towel up just a little bit and then laying right back over on it. And that's how it helps the spine, and it should relieve some of that pressure. And I'm going up to the top spot right where my top of my shoulders are, and again just laying back across that towel. And that should help with that tension right at the mid back and in the bra line. And that's a really great stretch to help that area. Okay, yay. So that one really helps a lot in that area. The chiropractor that I work for, he assigns that exercise to all of his patients to do because of the way that it makes the spine move better together. It really does help relieve that pressure going up into the upper area, you know, that mid back and up. So I just got asked how often do I recommend stretching? And I would recommend stretching every day, at least something little to help relieve some of that tension. And like I said, if you can do it while you're on the couch watching TV during a commercial break, you're probably going to do it more, you know, because you know you can do it in quick 30 to a minute, you know, 30 seconds to a minute. You'll do it every night. I always keep all of my exercise equipment or stretching stuff in a little basket by the couch so that I can just get it out and I can do it while I'm sitting there. All right, thanks everybody. And remember, take care of your body. It's the only one you have.